Uh, Good morning, everybody. And today we're going to talk about the Delta variant of COVID-19. As you see, just a couple of weeks ago, that CDC predicted this is going to be a dominant strain, and it is becoming very dominant. As you see here, in the last 11 days, it has tripled to 31% of all the US coronavirus cases, and this is a dangerous trend, and it perhaps is going to rock the steady decline in our cases. And as a matter of fact, I'm actually seeing a patient right now, and it is kind of dangerous. So I want to bring to the attention of this Missouri city evidently has a spike in hospitalization, and that is from the COVID variant. So it's of a great concern. So I want all of us to pay attention and see what we can do to help stop it. And as you see in Britain after the India that has the devastation from Delta variant, United Kingdom had, in a matter of 1 month, the cases went up almost close to the 6,000. And so you can see how fast it can spread. So rapidity of the spread is one of the hallmarks of this Delta variant, and it is supposed to affect the young population. As you see here in Britain, youth evidently tested positive 5 times higher than the seniors, and that is of a big concern. Especially the CDC has urged all the parents to have their teens vaccinated, especially given increased hospitalization, rapidity of the spread, and increased mortality, death rate. Young people dying from this. It is a serious matter. So I want you all to pay close attention, and let's look at what are all the symptoms. As you may already know, that the loss of smell and taste and the cough, that we used to talk about the traditional COVID-19 is not there with the Delta variant. We may have patients coming up with a headache, little sore throat, running nose, and fever. They might think it's just a little runny nose or maybe upper respiratory tract infection, and they need to get tested because it could be a Delta variant of COVID-19. And for all those people that have been vaccinated with Pfizer and Moderna vaccination, you can be assured that you have a good protection against the Delta variant. Especially the ones that are not vaccinated is the focus. And as you see here, Mississippi is the bottom in terms of the unvaccinated Americans, and you have Alabama and Louisiana. So we're third from the bottom. And let's look at the state of Louisiana. This is something it clearly shows that we are maybe in the 30s or maybe close to 40%, and we are supposed to reach 80% for a herd immunity. And is it possible? Yes, it is possible. But some optimists think not only the vaccination, but there is some proportion of patients that have been infected that developed antibodies. They think together, might help with this herd immunity. So in any event, I think our goal should be to increase the vaccination numbers. Way back, when COVID Crusaders and the leader, Carla Brown, started with the Canon Hospice, reaching to the community, especially the Black and impoverished neighborhood, we saw a disparity of 25.6% among the Blacks as against 62.39% vaccination in East Baton Rouge Parish. And that's when, the home visits started to not only register and now to give the vaccination as well. So Carla Brown, it has set up a role model, and we can safely say, or I'm proud to say, it's Carla Brown's model of vaccination. So we're actually reached perhaps a peak in having people go to certain centers or places to go get their vaccination. And it is a time for us to go to their homes for the people that haven't been vaccinated. And this is exactly what was done with the COVID Crusaders from Canon Hospice and Carla Brown. And I'm so reminiscent of this effort when Canon Hospice was there for 2 decades, and especially during Katrina, where the whole Canon family, including myself and my own children, Prakash is there, so he's watching. We were there, and Ruby Jones was recognized on the Newsweek magazine's front cover right next to Brad Pitt. So it was a joyous moment, and it is the same situation now with Carla Brown, and Canon Hospice, and I'm so proud that Canon Hospice is serving as a concept in community care way beyond the hospice. And this is where we knock on the doors and all the stuff. So little did we realize that this was going to help with the Delta variants. So Delta variants evidently affects the under-vaccinated people, and especially there are a lot of counties. It's not just the East Baton Rouge Parish. You have several counties within Louisiana. You see about several of them that I mentioned. And I'm hoping that we can use this Carla Brown model of knocking on the doors and giving vaccination in any of those counties or parishes in Mississippi, Louisiana, Alabama. And that'll be a great opportunity to bridge the gap of this vaccination disparity. And it has already got the attention of the governor of Louisiana. And as you see here, this was a press conference on the 3rd of this month where Carla told her story and her mission of knocking on the doors and giving vaccination. And I hope it catches the same attention in Mississippi, Alabama. And I want to close by saying that there is a great optimism, but we all need to work together. And in terms of the numbers, we need to work hard. And just to sum up, Delta virus is a notorious variant of the COVID-19, which can spread fast. It affects the young people. It can make them sick and could result in death. So I want everybody to pay close attention and make every effort in trying to reach those who are not vaccinated